My name's Brenda Crump, and I'm a student nurse, and I'm going to be performing a neurological assessment on you today. Can you tell me your full name?
Allison Hayes.
Allison, we're going to be videoing this for educational purposes, and then we're going to be posting this on YouTube, and it will be on YouTube for several weeks and uploaded to my instructor. Do I have your permission to do so?
Yes.
Okay. We're going to start with some questions today. I'm going to get a brief medical history, and then we'll be doing a physical exam. Are you okay with that?
Yes.
Okay. Can you state your full name?
Allison Hayes.
And your date of birth?
1462.
Okay. And can you tell me a little bit about yourself? What is your profession?
I'm a nurse.
And how long have you been a nurse?
28 years.
Okay, great. And what area of nursing do you work in?
I work in pediatrics.
Fantastic. And I'm going to be asking you several questions about your history. Do you have any history of headaches or migraines?
No.
Okay. Any head injuries?
No.
Any dizziness or vertigo or getting up, feeling faint or dizzy?
No.
Okay. Any history of any seizures?
No.
Any tremors in your face or hands that you've ever noticed?
No.
Any weakness in any body part? Arms, legs?
No.
Okay. Any problems with coordination or balance?
No.
And any numbness or tingling in your arms or your legs?
No.
Any difficulty swallowing with liquids or solids?
No.
Any exposure to any environmental hazards or occupational hazards like insecticides or lead?
No.
Do you take any medications?
No.
Any allergies?
No.
You're very healthy. That's good. Not too many
That's
people
right.
can say that. Any previous surgeries?
Yes, C-sections.
Okay. How many C-sections? Two. Great. And do you have any history of strokes or mini strokes?
No.
Any history of meningitis?
No.
Okay, great. You're very healthy. We're going to start with our physical exam. I'm going to be going through and doing all of your cranial nerve assessments. Okay.
Okay.
First, we're going to start with the first cranial nerve, and that's the olfactory nerve. If you can take one finger and include one side of your nostril and sniff for me. Great. And the other side? Great. Any problem?
No.
Okay. I'm going to have you close your eyes, and I'm going to ask you to smell with one side of your nose. Okay? And tell me what you smell.
Okay.
Okay, sniff.
That smells like coffee.
It is. All right. Have one more. Now with the opposite nostril. Sniff.
That smells so like cinnamon.
It is. Great. Okay. And now we're going to do your second cranial nerve, which is your optic nerve. Do you wear glasses or contacts?
I wear reading glasses.
Okay.
A little bit.
All right. Okay. We're going to do the eye test with the Snellen eye chart. And we're going to stand about 20 feet away. If you can stand right here for me, I'm going to give you a card. And if you'll cover one eye, and if you'll read this line for me.
The top next to the green line.
Yes.
FELOPZD.
Very good. And if you're
To the other
do
eye.
your other eye, we're going to go backwards.
DZPOLEF.
Very good. And let's do this line right here.
DEFPOTEC.
Very good. Opposite eye.
CETOPFED.
Excellent. You have 20/20 vision in both eyes. Okay, and if you'll remain standing, we're going to do another test. And this test, we're going to be checking your eye muscle. I'm going to be checking for eye muscle weakness. And I'm going to hold my finger, and then I'm just going to ask you to follow my finger. Okay? Very good. Any problems, any difficulty seeing in any area?
No.
Okay. We're going to do one more test. This is the confrontation test. And you're going to take one card, and I'm going to take one card. I'm going to cover my eye, and I want you to cover your left eye also. And then I'm going to take my finger, and as I move my finger in, I want you to let me know when you see my finger. Okay?
I see it.
Okay, great. Let's do it one more time.
Right there.
Excellent.
Right there.
Very good. Now let's do our other eye. And this is checking your peripheral vision. Very good. And we should both see that at the same time, and I saw it as you did. Okay, you can have a seat. And now I'm going to be checking your third cranial nerve, and this is your oculomotor nerve. And I want you to open your eyes real wide, real wide, real wide. Excellent. I'm checking your eyelids, and there is no drooping, and I see no nystagmus. I'm also going to be checking your pupils and see how they are reactive to light. You just look straight ahead at me. Very good. Very good. Your pupils are equal, round, and they are reactive to light. Okay. Our next cranial nerve that we'll be doing is the fourth cranial nerve, the trochlear cranial nerve, and we're also going to be doing eye movements again. We're going to be doing downward and inward eye movements, okay? So you just follow my finger. Very good. I'm going to do the other side. Very good. Next, we'll be doing lateral eye movements, and this is the sixth cranial nerve, the abductans, and we'll be doing from right to left. Very good. Any difficulty seeing in any areas?
No.
Okay, great. Next is the fifth cranial nerve, and this is the trigeminal nerve. What we're going to be doing is I'm going to be testing the sensation, your facial sensation. And I have a cotton ball here, and we're just going to be putting it on your face in different areas, and you let me know if you feel that sensation, okay? I'm going to have you close your eyes, okay?
I feel it.
Okay,
Feel it.
great. And again,
Yeah.
okay? We're going to do the other side,
Feel it.
okay?
Feel it.
Okay,
Feel it.
okay, great. I'm also going to be checking, this is part of the same cranial nerve, your facial muscles here. Let me know if you feel any pain or discomfort as I'm doing this. I'm going to ask you to clench your teeth really hard there. Good, muscles feel very equal on both sides. I'm going to push down on your chin. You clench your teeth and hold your jaw shut. I cannot open it, and that is exactly what we need to see. Great. Next, we're going to be doing your facial nerve, which is the seventh cranial nerve, and I'm looking for symmetry on both sides of your face. I need you to smile real big. Smile. Very good. Okay. Frown for me. Okay. Raise your eyebrows up. Okay. And then I want you to put some air in your cheeks and puff your cheeks out. Okay. I'm going to push it out. Okay. And it was equal on both sides. Face is completely symmetric. Great. Next cranial nerve is the eighth cranial nerve, and this is the acoustic nerve. And what I'm going to be doing is a whispered test. I'm going to, on one side of your ear, be pushing in and out, and I'm going to whisper on the other side. I'm going to give you numbers and letters, and then you tell me which numbers and letters I whisper to you on each side. Okay?
A-P-J.
Very good. And do the other side.
3-D-B.
Very good. Okay? We're going to be doing next the glossopharyngeal nerve and the vagus nerve, and this is the 9th and 10th cranial nerve. What I'm going to do is get a tongue blade here. I'm going to depress your tongue, and when I do that, if you'll say ah, if you'll stick your tongue out, say ah. Very good. Your uvula and soft palate are midline and moving with voice. I'm also going to ask you to say a few words for me. If you can repeat your name again.
Allison Hayes.
Okay, your voice is very streamlined. It sounds smooth and it does not sound strained. Have you ever had any difficulty speaking at all?
No.
Okay. Next is the 12th nerve, and this is the hypoglyceal nerve. And I'm going to ask you to say certain words for me. If you'll say light, tight, dynamite.
Light, tight, dynamite.
Very good. Your voice is clear and very distinct. Also, I need you to stick your tongue straight at me. Okay, it is midline. Have you ever noticed any tremors on your tongue?
No.
Okay, I did not see any. And the last cranial nerve that we'll be looking at today is the spinal nerve. And I'm going to be examining your sternomastoid and your trapezius muscles. I'm going to put one side of my hand up against your face, and I want you to push towards my hand there. Very good. Very good, and it's equal on both sides. I'm going to be pushing down on your shoulders. I want you to shrug your shoulders up. Very good, equal on both sides. Okay? Next, we'll be doing a series of different physical exams to be testing things such as gait and balance, okay? I'm going to be testing your muscles. If you'll stand up for me. And I want you to make your arms just real loose, okay? You'll be moving them in different positions. I should feel some resistance with that, and I do. On this side. Is there any pain or discomfort as we're doing this?
No.
Okay, if you have a seat for me again one more time, sorry. There's a lot of getting up and down, and I'm going to do that with your legs also.
Do I need this one?
Perfect, okay. I feel some slight resistance, which is perfect, exactly what we should be feeling with that. Okay, all right. Next, we'll be doing a gait test. If you would, you stand right there. And if you'll just walk to the wall and walk back normally. Very good. Okay. And now we're going to do the heel to toe test. So if you just walk and then put your toe up against your heel and walk to the wall, and then you can walk back normally. Checking for balance and coordination. It's like you're walking on a balance beam. Okay, we're going to do the finger-to-finger test now. I'm going to hold my finger out, and I want you to touch my finger, and then touch your nose. Okay, we're going to alternate with your hand.
Oh.
Alternate hand, that's fine. And I'm going to move my finger to different positions, and you just touch your nose. Okay, very good. And now I want you to do your finger-to-nose test. So you put your arms straight out, and then alternating, going at a pretty steady speed, back and forth. Very good. Okay. Next, we're going to be doing the Romberg test. And with this test, we're checking for balance and coordination also. You stand with your feet straight together, and then close your eyes and just stand there for 20 seconds. Let me know if you start feeling dizzy at all and need to sit down. A few more seconds. Perfect. Any difficulty doing those tests?
No.
Okay. And now we're going to be checking some strength in your legs. I'm going to ask you to kind of hop on each foot, just for a second, like 3 hops each foot. Okay, next. Perfect. Okay, great. Thank you. All right, we can have a seat right back there. And now we're going to be checking coordination if you can sit with your legs hanging off there. Okay, and on your knees, I want you to take your hands and alternate back and forth from the front to the back for a few seconds. Okay, great. And then if you'll give me one of your hands, go around this way. And if you'll close your eyes, I'm going to move your finger, and you tell me if I'm moving your finger up or down.
Down, up, down, up.
Okay, I'm going to do the other hand.
Down, up, down, up.
Okay. Next, I'm going to be testing your fine touch senses. I'm going to put some objects in your hands, and then you tell me what the object is. Okay, I'm going to have you close your eyes. Okay, I'll put the first object in your hand, and you can feel it and move it around.
Paperclip.
Very good. Next.
A coin.
Okay. You know what coin it is? That's a trick question.
A quarter.
It is. Very good. I've got one more object to put in your hand. Okay.
A pencil.
Very good. Next, I'm going to be testing grasphesia, and I'm going to trace a number in your hand, and you tell me what number it is. Okay?
3.
Excellent. Let's do the other side. I have to stand this way because I'm right-handed.
A 6.
Very good. Okay. Next, I'm going to be doing a 2-point discrimination test, and I'm going to take 2 paper clips because it kind of it doesn't feel sharp, it won't hurt, but you can just kind of feel the edges there. I'm going to put them in 2 spots, and I'm going to move them close together. As you feel them become 1 point, you let me know.
Okay.
Okay, so if you'll just close your eyes, maybe we can move your sleeve up here. Thank you. That's good. All right, you relax your arm down. You get comfortable. Okay, so you can feel these 2 points, right?
Right.
Okay, I'm going to move them close together. Tell me when you feel them become 1 point.
Right there.
Very good. Excellent. Okay. I'm going to do a light touch test. This is very similar to the last test that we just did. but this is going to be very light touch that I'm going to do in different areas, and you tell me when you feel the sensation of me touching, okay? For this test, it might be better if we lay down a little bit. Will that be okay? Okay. Might do your legs and your arms, okay? And what I'll do is I'll actually go like this for the light touch instead of the cotton ball, okay? All right, you let me know when you feel.
Okay, I feel it here on my leg,
Very good.
on my thigh,
Very good.
on my upper arm,
Excellent.
on my left arm.
Very good. Okay. Next, what we're going to do is the pain test. And I have... it won't hurt you, I promise. Okay, this is going to be sharp, and this is going to be dull. Okay? So I'll do it in different areas, and you tell me if it's sharp or dull. Okay? If you'll just close your eyes. Okay?
Sharp,
Very good.
sharp,
Very good.
dull,
Very good.
dull.
Very good. Okay, and for this, and I'm sorry, you're probably getting dizzy, but if you'll lay back for me one more time, we're going to do the extension test. And with this, I'm going to touch an area of your body on both sides. And then I'm going to move my hands away. And if you'll tell me if you felt it on both sides and exactly where I touched you, okay? My knees, very good. My elbows, very good. Okay, and for this, we're going to do the heel to shin test. If you would, we'll just slide your shoes off. Okay, and then if you lay back for me, we're going to take your left leg, bend it up for your heel to touch your knee, and I want you to slide it all the way down to your foot there. Very good. And if you'll do the other side, very good. We're checking coordination with that, and that is also intact. Now we're going to be doing a vibration test. And what I'm going to do is I'm going to create a vibration with this tuning fork. And then I'm going to touch by your big toe here. I want you to tell me when you start feeling the vibration and when you stop feeling the vibration. Okay?
Do I need to close my eyes?
Yes, please.
I feel it. And stop.
Excellent. Okay. And lastly, what we're going to be doing is checking your reflexes. And what we can do is, since you're sitting right there, what we can do is we're going to check your quadriceps reflex. Very good. Very good. I'd say that's a 2+. And while you're sitting there, if you'll just lay back for me, we're going to check your Achilles reflex. I'm sorry, can you scoot back? Okay, great. And you kind of let your legs, kind of fall out there. Okay. Very good. Very good. Okay, you can sit up. We have a couple more reflexes here. I'm going to check your biceps reflex. I'm going to let your arm relax in my arm. Okay. And then do your triceps reflex. Let your arms feel kind of loose there. Okay. And one more. Okay. Very good. And our last reflex, and then we'll be completed. Kind of interlock your fingers. And I'm going to pull on your thumb here. Okay. Very good. Okay. Thank you very much for allowing me to perform this neurological exam on you today.
You're welcome.
Thank you.